Review Summary. Brody's Human Pharmacology 7th edition is a complete guide to the pharmacological treatments used for different diseases and conditions in the human body. This book is divided into 9 comprehensive sections, each dedicated to a particular field of pharmacology, thus making it a must-have study material for medical students and healthcare professionals. Section Summaries. Section 1, Drug Mechanisms and Therapeutic Principles. This section provides the groundwork for comprehending how drugs interact with the body, basic concepts of pharmacokinetics, drug development process, and pharmacogenetics. Section 2, Chemical Mediators and Drugs, affecting autonomic and neuromuscular synapses. It focuses on medications that affect autonomic nervous systems such as cholinergic drugs, adrenergic drugs among others, along with their clinical uses. Section 3, CNS active drugs. This part covers neurologic and psychiatric disorders like Alzheimer's disease, Parkinson's disease, etc., which can be treated through pharmacological means. Section 4, Drugs for analgesia and management of migraine headache. Here different types of analgesics are discussed, including opioids, narcotic pain relievers, non-opioids, non-narcotic, as well as anesthetics. It also talks about how migraine headache can be managed using various approaches such as abortive therapy or preventive treatment strategy. Section 5, Anti-inflammatory, anti-allergic, and immunomodulating drugs. This section deals with gouty arthritis, allergic reactions, autoimmune disorders, etc., management of which is explained based on the principles of pharmacology. Section 6, Cardiovascular drugs. Pharmacotherapy for hypertension, high blood pressure, heart failure, arrhythmias, irregular heartbeat, hyperlipidemia, high cholesterol, etc. are addressed under this category. Section 7, Endocrine drugs. Management of diabetes mellitus, thyroid disorders, among other endocrinological conditions is discussed here in relation to pharmacological interventions used for their treatment. Section 8, Chemotherapy of infectious and neoplastic diseases. The use of antimicrobial agents, antibiotics, antiviral drugs, etc., for treating infections as well as anti-cancer medications, anti-neoplastic drugs, are elaborated upon in this part. It further outlines principles behind selection and rational use of these chemotherapy agents. Section 9, Special Topics. This section looks at different patient populations, including geriatric patients, pediatric patients, pregnant women, and those with dietary restrictions. Pharmacologic considerations specific to each group are taken into account in order to achieve optimal therapeutic outcomes while minimizing adverse reactions. Review from a medical student's perspective. Usefulness and applicability. Brody's Human Pharmacology 7th edition plays an important role in my understanding of drug mechanisms and their clinical implications, since I am currently studying medicine, which involves complex knowledge about various drugs used for different purposes. The textbook provides detailed explanations on how drugs work at molecular level, which makes it easier for me to appreciate the applied side of pharmacotherapy. Learning value. I find that the book is well organized because it has been divided into several sections, thus facilitating my learning process even during revisions. Additionally, every chapter offers some insights or examples from real-life situations where these principles can be applied, hence enabling me as a medical student gain practical skills necessary for applying this knowledge when dealing with patients. Ease of reading. The content arrangement guides beginners through unfamiliar territory, since they can easily follow what is being taught stepwise without feeling overwhelmed by too much information all at once. Furthermore, bolded keywords together with brief definitions make reading faster, especially during exam times in medical school where there is limited time available for study purposes. Moreover, inclusion of current research findings ensures that the book remains relevant to contemporary clinical practice as far as drug therapy is concerned. In conclusion, without any doubt, Brody's Human Pharmacology 7th edition is an extensive resource which connects theoretical understanding of pharmacology with practical application at bedside. Its inclusive coverage on various drugs in relation to different disease states makes it a valuable study aid for anyone pursuing medicine or those already practicing within this field and hoping to expand their knowledge base further.